Of New Day Northwest is sponsored by Dr. Shawn Keller, Smiles by Design.
Welcome back. A unique procedure can give people radiant new smiles that last a lifetime. It's called Same-Day New Smile, a revolutionary approach pioneered by Dr. Shawn Keller from Smiles by Design in Redmond. He is here with us today. Welcome. How are you?
Great. It's good to be here.
You probably did this because there was a need. What was it that caused you to come up with this approach?
Well, what we found is there's a lot of people who, no matter what they do, the teeth are just on their way out. Maybe not this year or next year, but over the next 10 years, they're probably going to lose most of them. And most people are very upset at the idea of being in a denture. And so to replace the teeth with implants, normally you need an implant for every tooth.
Right.
And the cost can get well over $100,000 to get your mouth restored.
Wow, I didn't know it was that expensive.
Yeah, and so I didn't actually revolutionize the technique to do just 4 implants and put a bridge on that, but doing it all digital and using stem cells, and in people who could normally have it, I've developed a technique where we can digitally scan your face, scan what you have there, and you can come in and have the bad teeth out, have the 4 implants in, and have the bridge put in the same day.
That's amazing. We have some video that shows the procedure, and if you would kind of talk us through it as we're seeing it.
Okay, yeah, this is my my friend Dana here. So he's been on the show with me earlier this year, I think. So that was the scan. So we digitally scan your teeth. That was the trio scan. Here's where we get a scan of your face so we can make sure that it looks good with it. Then I've got a digital image of the patient in my laboratory. And so we can see how the smile looks without having to try it in.
Right.
And then there's the the CAT scan of him, so we know exactly where to put the implants so they fit within the bridge, so that so it feels very comfortable and natural.
Because that's important. That's part of what people don't like about dentures.
Yeah, and then there's where we plan the implant position, make sure it's in the strong bone that's there. People who were told they don't have enough bone, this works for them because the way we plan it. So there's my milling machine where we actually make the bridge right there. So design it digitally, and then it's made from these pre-made ultra strong blocks. And then I'm just customizing it and adding some gums and trying to make it look pretty.
Look at that. And then you mentioned stem cells. How do they work in this?
So we draw your blood, and your blood isn't actually very rich in stem cells, but it has a lot of growth factors which activate the stem cells. And since your bone marrow is an area that's very, very rich in stem cells, when you place this concentrated growth factor there, it activates the bone to attach to these implants very strongly and very quickly.
So this is a solution for a lifetime?
It's the implants are intended to last a lifetime. This bridge that goes in that we put in the same day, the hope is that it looks great and I customize it. That's your healing bridge. It looks great, you wear that for about 4 months, and then we design, there's a bunch of different types that you can get after that, but there are some that we can make that do last a lifetime.
Wow. Now, are people asleep when you do this? What is the patient experience?
Yeah, I prefer to have them asleep for it.
I think I'd prefer to be asleep.
Yeah, like we just want you to come in and make sure that this is the right procedure for you. And then if so, then the next day we can have you go to sleep and you'll wake up with your new bridge.
That must be amazing. How do people react when they see this?
I mean, it's, like usually tears of happiness.
I would think so. I mean, especially if you've been struggling with ill dental health for all of these years and didn't have a lot of hope, and then you just wake up with a brand new smile.
I mean, yeah, usually, like you said, usually the people that have been through this, root canal here, crown there, every time they go in, it's something very expensive that they need.
Painful.
Yeah, and it's going towards something that's ultimately going to fail anyway. Like this is meant to go the distance.
Right. All right. Let's take a look at some before and afters. This is always my favorite part of anything. Let's take a look.
Lavanya.
Tell us about Lavanya.
Oh, poor thing came in and her teeth were going bad. We don't know if it seemed to be like an enamel disorder where the enamel wasn't very strong, so her teeth were going bad quickly. She just had a newborn baby and she couldn't eat the nutrition she needed to produce enough breast milk to feed the baby. So that was one of her main complaints. So we were able to get her new set of teeth, and now she's eating those crunchy, healthy foods that you can only eat with a good set of teeth, and she's producing better breast milk, and I hope the two of them are doing better.
And she looks beautiful. Let's talk about this guy.
Oh, this is Manuel. So he had a upper partial that was not very comfortable, and it didn't look very good, so we didn't wear it very often. So he came in and we designed his smile and had the last few teeth out and put in this bridge the same day.
He looks great, and he looks like 20 years younger and very happy.
Yeah, and so
who's this?
So this is Steven, and he came in and we he had a partial that was only on the right half there. So he had his left set of teeth, but the right half. And again, most people, when they get these partials, they don't wear them very much because they're so uncomfortable. And he was told that he couldn't take implants because he didn't have enough bone. But using this technique, we can angle them in some very special areas. And he wakes up with his new set of teeth.
Oh my gosh, and look at this one.
Yes. Oh, this is Robert. He flew down to see me from Alaska.
He looks dazzling with these new teeth.
Yeah, that was his first one. I believe we toned down the shade on the next one. Yeah, sometimes we can customize the shade a little bit. I felt like that was a little too white for him, so we actually toned it down a little bit since I did this one. But yeah, again, he woke up with his new set of teeth and very happy.
It's amazing. What's the healing process like?
Amazingly, and it's hard to believe, but when Dana was on the show with me last time, people are very comfortable the next day. It's usually the teeth that have the nerves in it is where the pain comes from. Once the teeth are out, it's just implants and bone, and there's not a lot of nerves there.
Right.
And the stem cells on top of that, most people are expecting a discomfort level that's a scale of 1 to 10, like a 7. The next day they're telling me, wow, I didn't even take my ibuprofen.
Wow.
Yeah,
okay.
So we're not needing narcotics anymore.
Which is important for so many different ways. Thank you so much for bringing this to our attention. I bet people just feel, like a new lease on life when you look good smiling and you feel like smiling. For more on Dr. Keller and the same-day new smile procedure, please visit the website on your screen. We'll also post links for you on New Day's website to make it easy to find him. Still ahead on Wellness Wednesday, treatment options for those with spinal stenosis. It's a narrowing of the spaces within the spine that can put nerves at risk. It's called baby boomer back. We'll talk about that after this.